what's up, Misty? Hey, Bailey. So, I'm gonna go ahead and start now because see if I can get this stuff figured out. So I know you guys know a little bit about me, but most people don't know what physical therapists actually do. So my first kind of goals on starting these videos are just to explain that there are so many things out there that physical therapists do that people like just assume are like leg lifts and hot packs and here's some ice and some exercises. You're gonna be great. What's up, lady? Hi, Miss Linda. So anyway, for those of you who guys don't know, I am a doctor of physical therapy, which means I spent an awful long time at school to be able to put those 2 letters in front of my name. It was awesome. But my area of focus is really women's health and the pelvic floor. And there's so many moms out there that think that things like leaking and pain with sex and incontinence and diastasis recti and postpartum depression are really like normal things. What's up, Reagan? Just for the guys that are watching this is mainly going to be for women, although you have moms, you have sisters, you know people that have had kiddos or are thinking about having kiddos. So if you want to share it with them, go for it. What's up, Adam? Hey, Emily. Good to see you, girl. But like I said, my main goals of these videos are really just to kind of make things a little bit more normal to talk about, because first off, nobody wants to talk about leaking or sex. It's like the biggest taboos in our culture. But I'm one of those people, I'm like, hey, let's talk about it. Another quick thing about PT is that we are considered the movement specialists, and anything with the body, which includes sex, is a movement. So if you've got questions, please let me know, type them in. If you don't feel like putting these on a public thing, feel free to just message me. But through being a physical therapist, I have been around a lot of moms, a lot of sisters, just a lot of people that don't know what, number one, what we do, and number two, that there's a lot of things that are considered normal that aren't normal. They're just really, really common. And a lot of people are just really surprised about the different changes that occur when you are pregnant or you do have hormonal fluctuations. And things like, what's up, Cody? Hashtag all my family's watching. Love you guys. So things like outbursts of anger or crying or anxiety after having baby are really common, not normal. Things like leaking or having an inability to hold urine, common, not normal. Whether you're pregnant, post-baby, in your 70s or 80s, really common, but once again, not normal. Having back pain after baby, during baby, there's a lot of weight changes that occur and how you actually wind up standing. Once again, really common, but it's not normal, and it's things that we can fix. And then one of my bigger things is just pain with intercourse. We're all doing it. You know, even if you're married, you're not married, I don't care. You're an adult, probably done it or thinking about doing it, or know people that, you know, have confided with you that these things are occurring. And once again, like this pain during these things is not normal. And I'm kind of really looking to make this kind of stuff something that people are willing to talk about and seek help, because just a lot of people are just living with these types of things. Hello, Miss LaRue. So my big thing is that I don't want you guys to live with this anymore, and I want you guys to know that there are ways that we can treat it. So as a PT, like I can treat all the things that we have talked about, and many of the things that I hear people just kind of live with. So if you've had multiple children, you're three out of 4 women that have multiple babies experience incontinence, and then 1 out of every 3 women that are on their first baby experience incontinence. And I get so many times that like Kylie Jenner, or excuse me, whatever the Jenner's mom name is, like she's like, oh, I just use these pads, it's so normal, leaking is normal and it's fine and we'll make it cool. No, you don't have to use poised pads. Like this isn't a thing. It's totally not necessary. And then one of the big things that I found talking with my moms is that postpartum depression occurs way more than anybody wants to talk about. For most people, it's a 1 out of 7 chance. If you've had depression before, it kind of pushes your chances up a little bit. It can last for months. It can take months to occur. So what I really want to talk about is like these things that we don't really know. Like if you're having outbursts of anger, reach out, talk to your doctor, talk to your friend. just get help. Because we don't want this to get any worse, and it's really natural for this to occur after you have a baby, and it sometimes actually starts occurring before you have had baby because your hormones are fluctuating all over the place, and your brain's having a really hard time just regulating those. And so it's, once again, it's really common, but it can be addressed and it can be treated. I know a lot of women are pretty afraid of admitting that they are having outbursts of anger or crying, or just, don't want to be around their kids, and that doesn't make you a bad mom, doesn't make you a bad dad. Not that depression occurs in men and women. Men, this is mostly for women right now. We will get to you at some point. What's up, Amber? So, like I said, my main goal is just to start a conversation, to talk to you guys about things that are occurring that nobody wants to talk about. Hey, Heather, thank you. What's up, Kim? So, as a pelvic floor PT, and I'm really beginning that transition into doing that and looking into classes and doing all this extra education, I just can't help but sit quiet anymore about what's going on. And I've had multiple people be like, oh, well, how are you educating everyone? And I'm like, well, how do you educate everyone? And Facebook Live is one of the greatest things. So I'm looking to start a series, and this is for anybody with a pelvic floor, which is every human being. It supports your organs, it sits in between your hips, and these things don't just occur in women, they are just generally more common because of birth and different things that are occurring with your hormones. So if you're male, female, you have a mom, a sister, an aunt, these are all things that are really important. And I'm going to talk about a lot of things that are really common during pregnancy and post-pregnancy and even just in regular everyday life, but that doesn't make them normal, and it doesn't mean you have to live with it. That is such a huge thing to me, is I don't want to hear moms tell me anymore, like, oh, I leak when I sneeze, it's no big deal. I'm like, yeah, it is. Does it bother you? Because, it bothers me, but if it doesn't bother you, that's a different story. But I just don't want moms to have these problems anymore. Like, I don't want them to be worried about, not being able to play with their kids on the floor because their back hurts. Like, and most of these symptoms have more than just one kind of function. Like, yes, they're affecting you and what you're doing, but then they're going to start affecting your relationships. They're going to start affecting your quality of life. And I don't want women to have to go through that anymore. I really don't want these symptoms to start affecting your relationship with your spouse or your children. I want you guys to be able to play and sneeze and run and have a great time and not have to worry about leaking or pain or any of those symptoms that you might be experiencing. If you are having any of these and you want to share on here, go for it. I know these things are really kind of personal, so if you want to just reach out to me, you're more than welcome, and we can start a conversation about, simple steps to begin to treat. A lot of this video a lot of the video series is going to be talking about like kind of common signs and symptoms and maybe a little bit of treatment, but if I am giving treatment out on here, it's a kind of a general thing, and it might not be right for everybody. So if it doesn't work for you, be like, oh, hey, this didn't work for me, is there anything else? And it might be indicative because there's a different type of problem than what some other people are experiencing, or just like the most common ones. So you can be treated. It's possible not to leak after having babies. It's possible to, get rid of back pain if you've had an injection or some type, or if you had to have, during labor, if you had to have an epidural. Like, it's really common to have pain after that. It's also pretty easily addressed. The same thing with back pain, neck pain. You guys, if you have pain at all, let me know. I'd love to start a conversation with you and just figure out how we can kind of bring all that back down. What's up, Jessica? Hey, Angel. So I'm so excited for this series. My next series is going to be probably on leaking and how it's really common and just the different ways to address it. If there's anything that you guys really are excited to, or just have burning questions about, leave me a comment, shoot me a message, shoot me a text. Most of you guys are family that are on here. Love you guys. And just let me know, because I'm so excited to help y'all. Thanks for watching, and I will get back with you soon. Bye.